Prime Minister is in self-isolation. The United States has called a state of emergency. Public spaces from schools to museums are closing. The federal government has pledged $500 million to help the provinces and territories to bolster their already overburdened healthcare systems, and $10 billion for businesses struggling to cope with a volatile stock market, quarantine workers, and the supply chain disruptions. But for all that, the question remains, is it enough? And while we have to be vigilant, both sticking to the facts and avoiding panic and irrationality, is the world prepared for what's coming next? Prime Minister Justin Trudeau joins us now for this exclusive English language interview from his residence. And I should say, before we start, that he put his equipment on and none of our crew was able to talk to him or touch him to do this. And Prime Minister, we really appreciate you making the time for us this morning. This is very personal for you. So I just want to ask, how is your wife Sophie's health, and how's the health of your kids?
Well, first of all, thank you, Evan, for asking. The outpouring of support has been amazing. Friends and folks from across the country calling in, sending us notes. We're doing fine. I've got absolutely no symptoms. The kids are similarly symptom-free. Sophie's she's got a headache right now and feeling a little under the weather, but it is not worse than what would be a bad cold. But of course, we're all being very, very careful, and that's what we have to do. At the same time, I'm working really hard, making phone calls pretty much all the time to whether it's world leaders, to members of cabinet, to our top science officials, looking at what it is that we need to keep doing, what it is we need to do next. It's very much an ongoing situation, and we're very much staying on it.
One last question, just personally, and we're glad to hear, by the way, that Sophie and the kids are okay and your family's okay. Donald Trump said yesterday, he said, I've been tested as a leader. A lot of people are asking us, why hasn't our Prime Minister been tested? Why not?
Because the advice of our best public health experts is it's not worthwhile to test someone who is not showing symptoms. If it were to come back negative, it wouldn't mean anything, because I am in isolation right now and need to remain in isolation, and that uses up a testing kit that would be better suited for someone who is showing symptoms who should be tested. So the recommendation is, if you don't show symptoms, self-monitor, self-isolate if you feel you've been exposed, if you're told to, but there's no need to get tested until you're starting to show symptoms.
Prime Minister, the biggest concern now is stopping the spread of the virus. Most cases obviously have come from people who have traveled from overseas and have come back to Canada. Are you considering closing the borders to places like Europe or even the United States, as other countries have done?
We have taken some very strong measures, and we're not taking anything off the table. We are looking daily at next steps that we might take or we should take, and those conversations continue. But I will remind people that when the outbreak first started in China, there was a lot of flurry around people needing to close borders, that was going to prevent things. Well, Italy and the United States closed their borders to China. We did not. We had the best advice from our public health saying, no, it's better to put in measures at airports and monitor people, and that was effective in not creating a spike in cases in Canada. We were able to track people. We were able to contain the virus at that point. So we're going to continue trusting our public health officials. But of course, we're hearing the concern that people have had. The shift in posture from the United States, of course, gives us significant things to think about, and we will be discussing it later today, among other measures, at our cabinet meeting.
Oh, okay. You will be discussing that because, look, many people in my own family have come through airports in recent days. They have seen no screening, nothing but voluntary suggestions saying things like if you've come from Iran or Italy or China, which is now out of date information. Why is there no mandatory screening at airports? Why is there no mandatory even spacing / social distancing at airports? Shouldn't that happen?
That is in the process of happening. I've heard directly from our public security officials in CBSA who are bringing in new measures right now. A lot of people who came back from, say, the Caribbean or somewhere else on vacation have said, well, I wasn't really asked much. Well, they were not coming from a place of concern, and therefore there were different protocols. One of the things we're very mindful of is we do not want public health officials to be using up their their time and resources at airports doing something that isn't the most impactful thing they can be doing. We need our public health officials, our doctors, our nurses focused on the communities and on the supports that they're doing in the hospitals. At airports isn't necessarily the best thing, but there are more measures we're looking at and more things we're going to do. We announced we'd be reducing the number of airports that will be accepting overseas travelers across the country, so we can better resource them to process the passengers the right way.
We don't know what airports. If you can tell us, that would be great. But there's a lot of suggestions that there should be mandatory self-isolation for anyone coming back from anywhere in the world. Again, Australia has just done that, and they've done it with enforcement measures. Are you considering mandatory self-isolation for anyone traveling into Canada from any other destination?
We are considering everything. There is nothing we have taken off the table. We're in close discussion with public health experts to look at what is the best way to keep Canadians safe, and every step of the way we have and we will do the things necessary to keep Canadians safe.
Prime Minister, one of the big, there's a lot of confusion. That one province is shutting down schools, another one isn't. We're getting a lot of confusing information. Shouldn't there be, even though healthcare is provincially controlled, could the federal government, and should they, orchestrate a totally coordinated response so there's no confusion that might undermine public confidence?
Well, what I can reassure people with is we are very much coordinating at the scientific level, at the public health resources side. All of our various local public health experts are speaking with each other. I spoke with the premiers just a couple of days ago, spoke with Premier Legault yesterday. We are making sure we are coordinating our approach, but the situation is different from one province to the next. What might work or might need to be done in Nunavut won't necessarily work in Ontario, and that's where we need to make sure that people do have the ability to make the right decisions for their jurisdictions. But it is based on close coordination, close communication, and there will be different postures across the country because there are different realities across the country.
Sir, one of the big concerns is, too, a serious shortage of ventilators at hospital for people who need it, and a serious shortage of test kits to test people. Even places like South Korea want drive-through testing. How will you ensure that there is both not a shortage of ventilators and not a shortage of test kits?
Well, that was part of the billion-dollar announcement we made on Wednesday to ensure that there is the equipment necessary right across the country. We're continuing to ramp up our access to those items. We're making sure there's a careful accounting of where they are so that we can ensure that they get to the people they need. That is an ongoing challenge that we are addressing, and we're going to make sure that people have the support they need.
Are you operating under the assumption that the world is headed for a global recession because of coronavirus? And if so, what would you do to make sure that our economy is protected?
I think there's no question that there is going to be a significant global impact because of coronavirus. You just look at what's happening around the world, and you know there's going to be real challenges in the coming weeks and perhaps months. What our focus is on making sure that Canadians can come out the other side, that we can bridge our way across this with the support we need. That means putting money in the pockets of people who maybe can't work and have to stay home to take care of their family. Putting money in the pockets of small businesses and credit accessible for them so that they can bridge a time where their supply chains may be disrupted, their workers won't be in. We can create supports so that once this time of stress, of difficulty, whether it be a few weeks or a few months, Canadians and the Canadian economy will bounce back. That is our focus, and that's where we will have significantly more fiscal announcements to make early next week about how we're going to support families and workers directly. So
the big question is speed here. The WHO keeps saying you got to move fast, not be perfect, but move fast because speed matters. Donald Trump is saying, he talked about a worst case scenario. Let me just ask you, what is the worst case scenario that you and that Canada is preparing for?
Canada's preparing for all scenarios. We have contingency plans for a low spread of the virus. We have contingency plans for a maximal spread of the virus. We know that it is much better to stay focused on keeping that curve flat, preventing and delaying people from getting it. And quite frankly, the efforts that Canadians have taken right now around self-isolation, around social distancing, has been extremely heartening to see how people are taking this seriously, looking for ways to keep their families safe, resigning themselves to talking to their elderly parents every day on the phone, but not going to see them for the next few weeks. Okay. These kinds of things are going to make a real difference.
Last question, Prime Minister. A lot of people are stocking up, they're panic hoarding. What is your message to people? Some people are panicking. Some people think we got to close the borders. There's a lot of fear. What is your message right now to Canadians who are doing that panic hoarding or shopping, and to Canadians in general?
Well, supply chains have not been disrupted. Groceries are still coming up from the United States, from elsewhere, and will for the foreseeable future. There is no reason for people to, stock up a little bit so you don't have to go to the store every 2 or 3 days like we usually do, but make sure that you're not taking more than you need, because your neighbors or vulnerable people will need to access the supplies as well. Being reasonable and thinking about the context we're in and not panicking about anything is going to be really important as keeping us through this as best as we possibly can be.
Listen, I know you're incredibly busy, and we really appreciate you joining us here on the program this morning from outside your residence. Please wish your wife and your kids good health and patience in the coming days, and as we all get through this. Thank you, Prime Minister. Appreciate it.
It's always a pleasure to speak with you, Evan. Thank you.